Hello everyone. My name is Dr. Caroline Lombe Simpungwe, and I'm an emergency medicine consultant, but also I have the privilege of being a trustee for the RMBF, which is obviously a great charity and why we're here today as well. So I mainly work in the emergency department at St Mary's Hospital, which is one of 4 major trauma centres in London. I also, though, have a do 1 day a week at Charing Cross Hospital Emergency Department, which is a hyperacute stroke unit, also in northwest London. To give you an example of a typical day, I'm going to describe a morning shift I recently did. So I came on to work at 8 a.m. in the morning. The only sure thing I knew on that day is which area I was going to be responsible for and the patients I took over. So I started my shift at 8 a.m. and I was allocated to be the trauma team leader that day in the emergency department at St Mary's and also the research consultant. And I was handed over 6 patients who were in the resus area and really, really unwell. And although they'd been seen by the night doctor, it was my responsibility to look after them. So I start my shift. 10 minutes into my shift, the red phone goes off. If any one of you have watched 24 Hours in A&E, that's a characteristic phone that goes off, and it's ambulance services phoning into the ED to let them know that they're bringing in a critically unwell patient. So seeing my patient with a head injury, and then I hear the characteristic red phone, and the tannoy goes off in St Mary's saying, medical adult blue call in 10 minutes. The nurse in charge approaches me. I'm working with another FY2 and hands me a sheet of paper to say somebody's coming in with DIB. So myself and the FY2 again, joy of teamwork, and the nurse in resus prepare for the patient. The ambulance crew hand over that this 70-year-old patient has come in with a 3-day history of fever, cough, temperature. They're really worried because they need a lot of oxygen and their blood pressure is really low. So again, as emergency medicine is, myself and the FY2 and the nurses immediately assess the patient. We soon realize that they've got severe pneumonia with sepsis and get IV access, send off the right medication, send off the right investigations and start them on antibiotics, which they need. Carry on working. 20 minutes into my shift, red phone goes off again. This time over the tannoy I hear, adult trauma call in 15 minutes. So again, I'm still working out or still managing the septic patient, but I've got a great FY2 I've worked with before. So I leave the FY2 to then go and prepare for the trauma patient. Handed over a sheet of paper. All I know is I've got a 40-year-old who's coming in with burns to the face and burns to the body, nothing more. We get ready as a trauma team, and then the patient arrives. Fortunately, in this case, on that day, the patient didn't have severe burns, had burns to the face, but nothing that compromised their airway. But again, as part of a multidisciplinary team, I lead this team, and very soon we treat the patient, and they eventually get referred to the burns unit. And then still in the morning, so within 2 hours, I then get a little bit of respite. I then start to review the other sick patients who I was handed over to. The phone goes off again, red phone. This time, tannoy goes off, adult trauma core and adult cardiac arrest in 5 minutes. That's all we're told, that's all you know. But again, it sets everyone's mind working in resus and in the department to come together because we know someone's sick. The nurse in charge comes, hands me a phone, the sheet of paper, and this time she gives me a look of Lombe, this is serious. The patient comes in with HEMS. This time, the story is of a 50-year-old patient who was witnessed to have a collapse. Fortunately for this patient, there was a doctor walking by and a paramedic, so immediately at CPR. After 17 minutes, they could feel a pulse. They gave him 3 shocks, and because he had sustained a head injury, ended up coming to St Mary's. Within 10 minutes, again, the trauma team, the cardiac arrest team, manage this patient. We get him to CT with 10 minutes, and we find that fortunately for him, he had no traumatic injuries. But lo and behold, what we actually found is that he had a blocked vessel in one of his coronary vessels. So that's the vessel that supplies the heart. And so there we go. As a team, we now know what this patient had. Within, again, another 10 minutes, we called 999. I'm speaking to a cardiologist at a local heart attack centre, and that patient goes to Hammersmith. So it's all very much, for most people who don't do EM, sounds very chaotic. And this is usually a typical morning for me when I'm in resus. So that gives you a little bit of flavor. But that's not what my work is like every day, to be honest with you. So as well as the clinical work, I also teach, support and mentor students, so doctors, nurses. I also contribute in research, which is a joy of emergency medicine. You can do a lot of things. And I have a personal interest in investigating when things go wrong in my department so we can learn from them. So that's the other aspect of my job. Now, all of that to most of you, or maybe it's just to me, obviously sounds very exciting. Emergency medicine is exciting and rewarding, but I'm not going to lie. With every job, there are the lows. And emergency medicine is tough. It is a fast paced job that's not for everyone. Currently, more and more, if you look in the media, the emergency departments are facing overcrowding. We're treating patients in the corridor. We have staff shortages. There is emotional stress and a moral injury to most of our staff. Burnout is a real risk. And the reason I raise this is because it's not just in emergency medicine, but with whichever specialty you specialize in, and also when you're studying as a medical student and your A levels, burnout is real. So it's important to have that work-life balance. For me personally, if we go back to me, I therefore have chosen my career in a way that I only work 4 days a week. I don't do nights. I do 1 in 8 weekends, which is very possible. So that's the flexibility with emergency medicine. And every other Tuesday, I do a late shift and an on-call shift. So when people ask me personally, would I do this job again, just to close it all up? For me, yes, I would. Because despite the challenges, I still think the highs outweigh the lows. I still love this job. I love the teamwork, the camaraderie, the undifferentiated patients we see, the fast pace. And above all else, I'm honored to have the privilege of having the opportunity of treating patients and their relatives when they're most vulnerable and knowing that somehow we make a difference. Thank you.